Hello, this is Dr. Do again. This video is still on alphabetic list problems. On letter R, I'm going to talk about the red blood cell diseases. I have mentioned, I have previous video about anemia, but today I'm just going to talk about all the red blood cell diseases. What are possibilities? Either not too much, it's anemia, or it's too much, which is called polycythemia vera. Polycythemia vera. Let me just first bring up the emergency situation associated with this red blood cells disease. If of course acute bleeding, either from internal chronic diseases or injury, then that's definitely is emergency. Or the too much of red blood cells increase the blood thickness. So if that's the case, probably associated with the thrombosis. If that's the case, either pulmonary embolism or the DVT, deep venous thrombosis. Either way, it's an emergency. Even though like the DVT probably the symptoms is minor, but if you see the two lower extremities swelling asymmetrically, or particularly for those who had risk, and also difficult breathing or increased heart rate for older people without any causes, particularly who had comorbidities, other diseases like renal disease or heart disease or diabetes. So these are the emergency signs associated with this the increased red blood cells. And also, in terms of the anemia, is there any emergency situation associated with this red blood cell disease? If acute hemolysis, actually, it usually occurs in the hospital setting. The most life-threatening hemolysis is the mismatched blood type, so that which means it's in the hospital setting, and or the other group who had pre-existing genetic red blood cell disease like hemoglobin abnormality or some other diseases may have emergency flaring up. For example, sickle cell crisis is another emergency situation. You have to see the physician as soon as possible to manage pain, to rehydrate, and to treat the symptoms. So these are the emergency associated with the red blood cell diseases. Actually, by the way, I did not think about this until I sit in the front camera. So I just probably talk a little here and there, but try to put everything together in order. So let me just talk about red blood cell structure. I think I mentioned it before. It's like a disc-shaped and about 120 days of lifespan, and also there's no nucleus. However, I'm going to talk about the reticulocyte, which is the precursor, immediately precursor of this red blood cells. The red blood cell generated from bone marrow, you already know the flat bone marrow produce the red blood cells through different progenitor cells, many classes, many different levels. And the immediate precursor is red blood cell, reticulocytes. You probably saw it in your lab results or see the reticular count, whether it's normal or not normal. This reticular count is very significant in the clinical, especially for acute setting of the hemorrhage. If the reticulocytes increase, which means the blood cell is lost through the so the bone marrow is trying to make more immatured red blood cells like reticulocytes released to the blood. So you probably see it. Just give you some. This reticulocytes have nucleus, not exactly, but it's just the remnant of nucleus. So that's different from the red blood cells. And also the anemia. I already talked about the 3 routes can cause the anemia. Either not enough or produce like iron deficiency, vitamin B12 deficiency, etc. Or increased disruption or hemolysis, either chronic or acute, by different causes, probably genetic fragility, of the red blood cell membrane, so cause this hemolysis. G6PD, like glucose 6-phosphodehydrogenase, a handful, the mouthful to say it, but it's not uncommon, or sickle cells or any other kind of abnormalities, or include the acute bleeding, leucid to the outside. So this is the three major routes, but individual each route there are many causes. I'm not going to go to the details, but in general, the symptoms, of course, you know it. If it is not emergency situation, what are the symptoms associated with this anemia? You already know it. Feel faint or fatigue, or look pale than usual, and lose weight without any reason. Particularly for older people or young female, you have heavy menstrual bleeding. These are all the signs you look for to check whether you have the anemia. And for those who had pre-existing genetic, for example, sickle cells, I'm sure your physician already told you what are the signs you look for, either the flare-up or the crisis, to see the physician as soon as possible. So for the this is about the not enough red blood cells. The other is the polycythemia vera, which means I do not know where the names referring to is a little complicated medical term, but it just means too much red blood cells in the blood. We know not enough is definitely not good because cannot carry enough oxygen. However, if it is too much than enough, it's also not good. This extra amount of red blood cells circulating in the blood increase the viscosity, the blood getting thicker, so flow slower, and also easy to clump together of these red blood cells together, and to clot, or to actually block the microvasculars, micro blood vessels, so cause this thrombosis, either small or large. So increase the risk of the thrombosis of the heart, or lung, or any other organs or brain, particularly for those who already had pre-existing risk factors like hyperlipidemia, diabetes, hypertension, or using estrogen. So on top of that, if this polycythemia vera occurred, usually then the risk of thrombosis definitely is greatly increased. The part of not happy or not optimal part is this polycythemia vera. It doesn't have a symptom, usually just very subtle, probably on no reason of flushing or itching. That's probably all. But if there's no particular symptoms, unless you test it, find out the red blood cells is too much. So for those who had, particularly for female actually, middle-aged female or overweight, this could be one of the symptom, one of the problem. What are the causes for this condition? I think it's unknown, or idiopathic, or genetic, or any other cause, or the bone marrow just respond to some signals, which is unknown. So this is about the red blood cell diseases. I think it's kind of addendum from the previous video of anemia, just talking at the other end of the too much of red blood cells. It's also could be very dangerous. So I'm just going to stop here and hope it helps. And if at least I hope it will trigger your interest to search more about this produce red blood cells, what can it do and how to treat it, what are the signs you look for. So I'm going to stop here, and thank you for watching. I will see you next time.